Today's session is enhancing your search skills, and our speaker is Tamara Nelson. Tamara is an associate professor and senior research and learning services librarian at the University of Tennessee Health Science Center here at Memphis. She has been an information professional for over a decade and is a distinguished member of the Academy of Health Information Professionals certified by the Medical Library Association. So Tamara, I'm going to turn it over to you.
Thank you, Margaret. Thank you for the introduction. So I'm going to turn off my camera for the presentation, but I just wanted to say hello to everyone. So let's go ahead and get started. So here are our disclosure statements that are included with our presentation. So let's keep moving. Okay, so today, as Margaret stated, we are talking about enhancing your search skills. So whether you are searching for something that you come in contact in your clinical work for evidence-based practice or for a research project or for a grant or systematic review, it is always useful to have these skills. So that's what we'll talk about, some ways to enhance your search skills. But as a disclaimer, I want to let you all know that you are always welcome to contact your university librarians. If you are affiliated with U of M, they have an awesome team there. And here at UTHSC, of course, I have an awesome team of colleagues, and we are here to provide assistance with you with your searches and your searching needs. But for those of you who are also willing to tackle searching on your own, I hope you learned something today. So the objectives for today are, I hope that after the session, you're able to identify search terms for your research topic, develop an effective search string based on a broader research topic or idea, and also that you're able to explore the advanced search features of commonly used databases, such as PubMed, Inbase, Cochrane, and Scopus. So we're going to talk about the Pico formula. Hopefully you all are familiar with that. If not, you will be at the conclusion of this session, and how it ties into developing your search. We're also going to cover search strategies that we as librarians use and we like to share with our patrons to assist with enhancing their searches. And then we are going to take a look at advanced search features within the commonly used databases that I had listed. So first, let's talk about the Pico formula as a way to identify your key concepts and terms. I'm sure if you completed a clinical program, you've heard of Pico before, and maybe you didn't think of it as a way to actually lead into your search. So we're going to talk about that. So what does Pico do? Pico frames your clinical research question. And what it does, it helps you focus the question to identify key concepts. So here I'm talking about how it links to your search skills. So it then also defines the concepts to be used in your literature search. And then also it helps to determine if articles that you retrieved in your search are relevant, because you could always refer back to your Pico to say, is it answering my question? So here's an illustration of the Pico formula. So of course the P stands for population, patient, or problem. So when you look at the P in Pico, you ask yourself the question, who are the patients? Where are the patients? And what is the problem? I stands for intervention or exposure. So with I, you're asking, what do we do to them? What are they exposed to? C is the comparison. So what is happening or what are they exposed to is also compared to the intervention. And then the outcome. So what happens or what is the outcome or what is the outcome that you're expecting from your intervention, your exposure, or your comparison. There's another variation to Pico, adding a T onto it that is commonly used, and the T tends to represent time or the type of therapy or the study that you're searching. So that's also something that you can add to your Pico formula to formulate your search. So when we look at Pico, there are different types of Pico questions, and the type of question that you ask does help yield your search terms. So for the first one, diagnosis or diagnostic test, that is used to determine which test is more accurate or precise in diagnosing a condition. So it'll be a question around that. Prognosis and prediction is used to determine the clinical course over time and likely complications of a condition. Then there's meaning questions. When meaning questions is used to determine the meaning of an experience for a particular individual, group, or community. There are also questions with intervention or therapy, and that is used to determine which treatment leads to the best outcome. And then there are also etiology questions, and those are used to determine the greatest risk factors or causes of a condition. So now we're going to take a look at formulating the question. So I'm giving two examples because I know we just covered the many different types of PICO questions that can be asked. So for this example, we're just looking at intervention and therapy and meaning. So if you're asking an intervention or therapy question, it's usually formulated like this. So in blank, what is the effect of blank on blank compared with blank? So in this question, the PICO formula is moved around, and that's what I want you to also note, that you can rearrange it or omit elements of it to fit your clinical question. In the meaning example, how do blank with blank perceive blank? So in that one, we're just using PIC as our example. So framing our clinical question in this format helps us to identify those key terms and concepts to include in the search. So when we look at developing the search, we are going to take the PICO question, like I talked about, to take out those key terms and concepts. So the process, so we have our PICO question, and from there, that's where we're going to extract our keywords. So when you're extracting those words and terms or phrases, you're going to use commonly used and those that are only essential to your research question. So that's why it's important to identify your research question, have a clearly defined research question, so then you can have clearly defined search terms when you go to do your literature search. So let's take a look at an example. So my clinical scenario, Susie is a 65-year-old woman who has come to you complaining about frequent canker sores. Susie currently only takes metoprolol, a beta blocker, for her hypertension. So of course, from this example, you or I are obviously a dentist, and Susie's our patient who's having canker sores. And you notice that her prescription medicine is metoprolol, a beta blocker, which is known to cause canker sores. So from that scenario, you decide to research the question: in an elderly patient with hypertension being treated with beta blockers, what is the best treatment for oral lesions? So now you're trying to treat her oral lesions based on the fact that she's taking this medication that's causing them. So using the PICO formula, this is what we've extracted from the clinical question. So our population, elderly. Susie is 65 years old, so she's an elderly population. So our intervention or exposure, we're going to take a look at over-the-counter numbing agents like Oragel, Ulcer Ease, Embase, and then we're going to compare that to prescription anti-inflammatory agents like Apisol, Kenalog, Diproline, etc. And what is our outcome? We want to relieve the outbreak of oral lesions caused by a beta blocker prescribed for hypertension. So with that, what keywords can we extract from our PICO to then search? So I'm asking a hypothetical question. I'm not asking you to answer the question, but I want you to think about it. So from that, we can search for the population, elderly. Now there's different ways to search for that. When you go into the database, you'll see you can add elderly into your search terms, or you may choose to filter by population type or age later on in the database. And I'll show you how to do that when we take a look in the databases. So we could also search for, okay, our intervention, we could look for over-the-counter numbing agents, or we can use the actual name of the over-the-counter numbing agent. So we could search for, say, Oragel, and a prescription anti-inflammatory agent. That is another term, or Apisol, we could use that. And then we could also represent our outcome by searching for oral lesions or beta blockers. So those, and hypertension. So those are all different terms that we could pull out of our Pico question to put into our search. So that's why it's important to have a clearly defined Pico, because those are the terms that you will then search for in the database later on. And I'll show you how to connect that together. So now we'll pause to have a conversation about keywords versus subject headings before we actually start stringing our terms together. So there are two different terms that we use in a search. One are keywords. Keywords are natural language words used to describe a topic. They are more flexible to search because it's literally just, you know, your terms like, for example, diabetes. I just want to search diabetes. High blood pressure, that's a keyword. I just want to search high blood pressure. So the database looks for those keywords anywhere in the record, not necessarily making any connections together. They may yield too many or too few results because it is a keyword, and it may yield many irrelevant results as well. Now, a subject heading, that is a predefined controlled vocabulary word used to describe the content of an item in a database. So databases such as PubMed have a whole team of indexers that have applied a controlled vocabulary to an entry so that the database can quickly direct you to that entry when you put in that subject heading term. So this is all these intricate algorithms going on in the background that you don't even know is happening. But using a subject heading is going to get you to the results, closer to the results that you're looking for, and quite possibly faster. But they are less flexible to search by, I want to be honest. And you have to know the exact controlled vocabulary term. So I will show you where to find those indexes in the databases. Databases look for subjects only in the subject heading or descriptor fields where most relevant. And if you have too many results, you could also use subheadings to focus your search with subject headings. And we're going to take a look at where to find those subheadings in PubMed using their controlled vocabulary, which is referred to as mesh. So results usually are very relevant to your topic, as I stated, when you're looking at subject headings, because the indexers have diligently worked to tag those entries together. So the thing is, when you are developing your search, they will be a combination of keywords and subject headings. Not all terms are a subject heading. They're not all represented. And then you'll find that sometimes keywords do lead to more relevant results. So typically you'll use a combination of the two. That is why we always suggest that if you get stumped or you have issues, to reach out to a librarian, and we could assist you with developing the search. And so, for example, my example with diabetes being the key word and high blood pressure being the key natural language word. For subject headings, for diabetes, there's several different subject headings, but diabetes mellitus is one of those in PubMed for diabetes. And of course, hypertension is for high blood pressure in PubMed. So we'll take a look at that when we look at the advanced features in PubMed. So now we're going to take a look at search strategies that you can use to develop your searches and enhance your search when used properly. So you may have heard of Boolean operator in the past, or just naturally use and to link a lot of terms together when you do a search. There are three basic Boolean operators, and, or, and not, and you can use Boolean operators to focus your search and produce a more productive search. And let's take a look at how. So for our example, we are looking at breastfeeding and music therapy. So the and operator is used to narrow our search. So in the example, we are looking at breastfeeding and music therapy. So I'm telling the database that I only want to search for breastfeeding and music therapy together. In our second example, we're using the Boolean operator or, and we're throwing in nursing with breastfeeding. Because what we're telling the database is that nursing is a synonym of breastfeeding. And so I want to make sure that if entry uses the term nursing versus breastfeeding, that I'm still retrieving it in my search. So I'm saying I want to broaden my search to be breastfeeding or nursing to capture everything. The not operator is used to exclude terms. So in our example, nursing, we are referring to nursing as breastfeeding nursing, not nursing as a profession. So using nursing, not nurse, is our way of telling the database that I'm looking for nursing as breastfeeding, not nursing as the nursing profession. So clearly this is just an example of how we use these operators. And once we go into the database, I'll show you how that is linked together. Another technique is search logic nesting. So when we talk about nesting, databases are machines and they require a precise language to operate. So what you're putting in is what they're reading, what the database is reading, and it's reading it from left to right. So using Boolean operators and nesting is a way to make sure that the database is reading exactly what you want it to read. So the database recognizes and as a primary operator and will connect concepts together with and unless you tell it otherwise. And that's important. And we'll take a look at an example next. So what we want to do is combine and with or operators in our searches using parentheses correctly to yield our best search strategy. And that's what nesting is. So we're going to use parentheses to nest things together so that the database reads it properly. So let's take a look at how that works. So we're back to our music therapy and breastfeeding example. So I want you to take a look at the two examples and take a look at them for a second, and then we're going to discuss why the top one is correct and the bottom one is not correct. Okay, so I hope you had time to look at that because I looked at it. Okay, so for the first search string, we use nesting properly because what we're telling the database is that we want you to first search music therapy. And then we want you to search music therapy with breastfeeding or nursing. And that would yield a proper result. So if you look in the bold on number 3 under the top suggestion, this is the correct search string, music therapy and parentheses, breastfeeding or nursing, close parentheses. So what's that's doing is it's keeping breastfeeding and nursing as synonyms together. And it's telling the database to search music therapy and breastfeeding or music therapy and nursing as synonyms. The second example kind of looks like it should be right, but what it's missing is the nesting. It's missing the parentheses. So when the database looks at this, what it's going to search is music therapy and breastfeeding together, and then add nursing to the end of it. And that's not what we wanted. We wanted to recognize breastfeeding and nursing as synonyms, and so kind of cluster those together so that it's not separating them out. So if you ran this search, what you would find is you would have way more results and less accurate results with the second example versus the first example, which clearly illustrates what you want the database to search. So nesting is just one of those techniques that we use. Boolean operators is one of those advanced techniques that we use when we're enhancing our searches. Now, all of this looks good in the PowerPoint on presentation, but we want to kind of take a look at, well, what will that actually look like in a database? So PubMed is primarily the first source we go to search in biomedical research because it's PubMed. I have no other reason. And it has advanced search builder features. It has the subject heading database mesh, and it also has filters and limiters that you can use to enhance your search. So what we're going to do now is take a look at PubMed and those features. So here we are in PubMed. And of course, it has just a general search bar to run a quick search here, and it has the advanced search feature. down at the bottom under the Explore section, you'll see where it says Mesh Database. So if you click on the database, that's where you'll be able to search for your subject headings or subject terms from the controlled vocabulary thesaurus. So I gave the example of diabetes, so I'm going to search for diabetes again so I can show you all the subject headings related. And like I gave in the example, diabetes mellitus comes up as the first, but there's also diabetes insipidus, and there's other entry terms and results for that, subject terms for that. So also what I talked about in the example was narrowing your search using subheadings, I'm sorry. So we have diabetes mellitus, which is the subject term, the index term. And then we could use subheadings underneath it to search quickly and specifically related to diabetes here. So you can look for drug therapy related to it. Now, if you choose to do a search in the mesh database, which I rarely do, but if you are doing a quick search, you can do it here if you're wanting to use subheadings to quickly search for something. So if I'm quickly wanting to do a search on drug therapy and diabetes, that would be the only reason why I would use the mesh database. But to build a comprehensive search for a comprehensive literature search, say for like a systematic review or your grants and things like that, you definitely do not want to search in the mesh database. So we're doing the drug therapy. That's my disclaimer, but I'm gonna show you how to do this. You could add it to the search builder, which would automatically add here, and then you can hit search PubMed, and it's going to retrieve relative articles to diabetes and drug therapy. So that's one way to search it directly from the mesh database, or to just search the mesh database in general for those subject terms or index terms, however you want to refer to them. Okay, so now we're going to go to the advanced feature of PubMed. So this is where you would build your search string using the Boolean language and everything that we discussed. This is where the magic happens in the advanced search feature of PubMed. So I did click on it from the other screen, but I want to go back to the beginning and show you where I got it from. So we got to mesh from the beginning of PubMed. So we're on PubMed. So you could also click advanced under the main search bar. And of course, that search I just ran is in my history down at the bottom. Okay, so we're going to build a search here in the advanced search builder. So you could add your terms to the query box. I also want to point out that you can narrow your fields here. They give you a whole bunch of different ways to field search. We're just going to do all fields, and I'm going to put in diabetes. And then you could click add to search, and the query box shows you your search as you're building it. So I'm going to link it with hypertension. I'm just doing a quick basic search. So it's already defaulted to have the Boolean operator and to link. But if you click on the down arrow, you'll see that you can do and or not as you build your search here. So we're just going to put it with and because I want to just search diabetes and hypertension together. We'll do just a quick search. With the search tab, I could hit search and it'll quickly take me to the results, or I can use the drop down arrow, click add to history, and it'll run the search and just place it down in my history so I can look and see what I'm working with before I go to my result list. And I like to do this because sometimes I like to do various variations of a search string to see what the results look like, the number of results that I have before I just end the search altogether and go look at the results. And it'll all show up in my history. So also in this history screen, there's some features that you can also do here. So under actions, the three little buttons, if you click on that, you can add this search back up to your query box. You can delete it all together, or you could also create an alert. So if I decided that this was my final search and I want PubMed to notify me every time new articles come out in this search, or I want to save it, I can create an alert here. the details feature, now this is a nifty feature. You click the arrow, it drops down and it gives you all of this language. This is how the database read my entry. I put 2 words in, diabetes, hypertension, and this is how PubMed read what I put in and how it ran the search and came about giving me 112,516 results. So as you can see, it did map to the mesh term for diabetes based on my entry. It also mapped to the subject term for hypertension, and then also searched it as an all field. So this is a great way that if you're saying like, am I not doing the right term? How did it read my term? This is a great way for you to go back and look at it here by looking at the details. Another example I'm gonna quickly do, because I know we talked about the variations in nursing, is if I put in nursing, as you can see, will search as breastfeeding. And so that's also a way for you to make sure that your terms are relevant terms as well. So you're seeing how the database translates your terms. So when you decide on which combination of terms is the correct search for you, I'm just gonna look at the results for my diabetes and hypertension search to kind of show you some more features. On the left side, you'll find the filters in PubMed. So we do have some quick filters here that if I want to look at just clinical trials related to diabetes and hypertension, I could quickly go to that. They also have English as a filter, English and humans as a filter, humans only, published last 5 years. These are just quick filters that you can, mind CBI filters that you could apply. And then you could also narrow the date range by the result by year, and it pops out so that you can move the bar, slide the bar to tell it what years. And 2022 is already here because there's already some pre-pub things out. So that's why you see 2022, even though obviously we're still in 2021. So you can narrow your search there. You could also narrow by article type. If you know you want a clinical trial, what phase it's in, interviews, journal articles, RCTs, SRs, all of these are things that you can narrow by, and then also the publication date. Like I just used the little quick bar, but you could quickly also set a custom range here under publication date. And then you could also use the filter, the age filter. And I talked about in my example that Susie was elderly. So you could also come here and narrow by age as well. These are the ages that were clearly defined in the results that came up. That's why you're not seeing elderly here, and why sometimes this age filter is not always the best filter to apply. You could also narrow by sex and language. There's just a whole bunch of different filters you can use. And then if you click on additional filters, there are additional filters that you can use, all designed to quickly get you to the relevant information that you're searching for. So that is my quick overview of PubMed and the advanced features that they have to enhance your search skills. I want to go take a look at some of the other databases. So Inbase is another database that we have. Inbase's coverage is similar to PubMed's coverage, and it actually does search Ovid Medline, just like, not Ovid, Medline, excuse me, just like PubMed does. But it also contains other entries related to drug and drug information, and it has its own control vocabulary known as MTree. It also has filters and limiters, just like PubMed, that you can utilize. So we're going to take a look at Embase and Embase features. So this is what comes up when you go to a search for Embase. So just similar to PubMed, but in its own way, it has Boolean operators built in as well. So you can change the operators. It has the ability for you to build your search with and or not. So similar to PubMed, you can build it here. So I'm not going to spend too much time in this area building a search because I want to show you that Inbase has some other neat features. Inbase has a Pico search. So I talked about Pico and how important it is to have a well-developed Pico question to search and extract your terms. So here is a way to take your Pico and put it into a database and search. So it has the population, the intervention, the comparison, the outcome. And I told you the little T stands for study design. So you also can add that here as well. Inbase also has a PV wizard, which is a way to build a search around a specific drug. So we talked about metoprolol in our example. So if I put metoprolol, I start off with the drug name, and then I go to the next step. It automatically searches for alternative drug names. So the database is telling me there's 9 variants of metoprolol that it could add to my search. And I'm like, yes, of course, please do. So then I click the next step. And so if I'm searching for adverse drug reactions related to metoprolol and alternative drug names to metoprolol, this is the search. It already built it for me. It already has it ready to go. So if I want to just stop here and just look at adverse drug reactions related to metoprolol, and I'm sure if I dig deep enough, I could find canker sores in there as a side effect to that. I could click down here at the bottom where it says show results, which there's a little over 25,000 results, or I can go to the next step and add special situations to my search. And so with the special situations, I could add these, which it already pre-adds humans, women, child. And it's just ways you could just quickly play with it and add different things to it and visually build a search here around a drug and its interaction. So I just thought that was a very neat tool to use. Inbase also has a medical device search. So if you're doing a search for a medical device, you could add the device and link it to any adverse effects and link it to your limiters and then search for it here as well. It just has a whole lot of different features to take you to the evidence quickly. It also has advanced search features that you can build your search in as well. And you can use these drop downs to narrow your search. And then it has the drug information search as well, disease search as well, which they all look the same. They're just searching drug or disease or device. And then they also have the citation information search. So if you have a citation or parts of a citation and you want to quickly run a search in Inbase, you could do it from this screen as well. So I did mention that Inbase also has a control vocabulary, which is mtree. And I was so excited to show you all the ways you could search in Inbase. I did not show you where to find their control vocabulary, which is located at the top right corner under mtree. And so you can search for terms here. So I'm putting diabetes in once again, and then it shows me it's diabetes, preferred term, diabetes mellitus, and all the different entries associated with them. So that's another way to browse mtree. You could also just search for the journals that are indexed in Inbase by clicking on journals. So those are some of the advanced features in Inbase, just a quick overview of the advanced features in Inbase. And I know you're probably, because I'm 2 databases in, and you may be in information overload about all of this. And like I said, this is just a quick workshop. If you are affiliated with the University of Tennessee Health Science Center, you're more than welcome to reach out to your liaison librarian, and we would be more than happy to give you a one-on-one in-depth look at all of these features and everything that goes along with it. And if you're not affiliated with us, please reach out to the institution that you are affiliated with. And I'm sure the librarians there will also be more than willing to assist you. So now let's go and take a look at Scopus. Scopus is also another commonly used database that we use. You can search by documents, by author, affiliation, sources, subject areas. Scopus is just one of those databases that helps you visualize and track research. Now, I'll tell you what I use it for. Mainly, I do use it to do an author search and to see what a specific author or researcher has published, where their works were published, and who has cited their works. But you can also search for a document. So if I have a document that I'm searching for or an article, and I want to know where that article was cited, who has cited that article, I also tend to rely on Scopus for that as well. So Scopus has its own set of tracking tools. I'm defaulted in here. We're going to search for Tamara Nelson, not me, Tamara Nelson, but we'll search for Tamara Nelson, just kind of show you what it looks like. So we're going to look at this particular one. And yeah, it just shows you gives you all this information about, she has 19 documents that have been cited 275 times, she has 7 co-authors, and it just gives you all of this information. It gives you her articles that are cited in Scopus, because I want to make the disclaimer, not everything that you publish will be in Scopus. I don't even want to pretend like it is, but this is showing you her body of work and where it's been cited. And so that's Scopus is a great tool for that. You could also search by subject if you want to see who is published on diabetes and hypertension. If I wanted to do that and see where they've published and where it's been cited, things like that. So yeah, there's just a whole bunch of different ways. They also have filters and limiters as other databases to filter your search and everything. So yeah, Scopus is also a great tool to utilize for searching. And then finally, my last database that I'm going to go over is the Cochrane Library. Cochrane Library also has an advanced search feature and a search manager. It also has a Pico search that is in beta format right now. So it's not as intuitive as the one that I was excited about in Inbase, but it's coming along. And it does search medical terms using mesh like PubMed. So this is the Cochrane database search. So there's already a search in here. And what I have found is that it will hold on to a search that you've done in the past. So apparently I've done this search in the past, even though I do not remember it, which tells you I probably do too many searches. So you could build your search here. You can click on search limits and it'll bring up a screen for you to apply limits to your search. And you could click here to run your search. And then it'll tell you what you have. So for my particular search term, there's just one trial that's been published and that's it. It was a very difficult search apparently. There's also the search manager feature. And once again, another search that I completed is still sitting here in the search manager. So you can build your search here by term. So it has my whole search string here, but you could take each term and place it on a different line and then search it together. So for this search here, this 18 results, it already tells me right here that I have 18 results related to this search. And it's just another way to build a search. And using the tabs, you can see how many reviews you actually have, how many trials you have, and if there's any other things like protocols and editorials related to your topic, you'll be able to quickly hit these tabs to get to that information. So it does have the medical term, the mesh database here for you to be able to search mesh in Cochrane. So they have all these terms related to diabetes. So if you just want to search complications and you want to click lookup, it gives you a match to your thesaurus match and phrase matches. So this is also just in synonyms related to the terms. Like this is also just a great way to make sure that you're getting relevant search terms and searching for the right information. So it just gives you all this information. And like I said, it has a Pico search that is in beta form right now, but it does have where you can add it to. So I'm just going to add diabetes. And as it started off with diabetes is not a population, but of course the P is the first one. So it automatically put that. So yeah, and then you could just add, and you could add the operators and or, and it just is another way to create a search in Cochrane Library. So that concludes my quick overview of how you can use advanced search features of various databases. And I have come to the conclusion of my presentation, but if you have any questions about any of the resources or anything that I covered, you can reach us at library@uthsc.edu. One of the things that I failed to mention about all the databases is the ability to save your searches, export to your citation managers such as EndNote, which is a great segue into my plug for Thursday's webinar, which will be on EndNote. And my colleague, Hillary Jasmine, who is a resident EndNote expert, is going to be available to show you how to use EndNote and get the best out of it with saving and creating your lists and searches. So if you have any questions, please feel free to ask them now, and I will try my best to answer. And also, I want to point you out to clinical research resources that are available to you. This PowerPoint is located on our Library 101 research guide, which is available for you to go to, and you'll find links to the introduction of MESH, building a PubMed search, just videos and information that are available to you surrounding searching.